World Tuberculosis Day was observed today with the theme Yes, We Can End TB at RP Chest Hospital compound in Shillong. The day is observed to raise public awareness about the devastating health, social and economic consequences of tuberculosis and to step up efforts to end the global TB epidemic. Secretary Health and Family Welfare Ramkumar S. graced the occasion in the presence of Director of Health Services MI Dr. R. Lingdaw, Director of Health Services MCH and Family Welfare Dr. F. V. Karshiang, Director of Health Services Research Dr. W. M. Karluki and other dignitaries. During the event, the Culture and Drug Susceptibility Lab was inaugurated within the hospital premises. Awards were presented to districts demonstrating outstanding performance. East Garo Hills District was honored as the top performer in combating TB within the state. It may be mentioned that Meghalaya has notified 4,974 TB cases in the year 2022 and 4,812 cases in 2023.
2-3 things are very important is what I feel. One, in TB, we need to demystify this disease even further in a language that communities understand. That is why the TB TB-free village panchayat or villages program has started. We are already there, about 250 villages will get the TB-free village status. But people have to understand TB in much more simplified manner. Until that, it would be very difficult for us to take this as a public health movement. This is such an important task. So the main challenge is to demystifying it and telling people that it is serious. If someone at home have had TB, we need to be, because this has a long dormant period. It can be there in body for 10 years, 15 years. It will not manifest immediately. After that, it will manifest. And TB can be cured. That is also something which we need to know with the proper treatment regimen. The treatment continuity has to be there, and it has to be made this proper treatment is possible to do until we take it systematically and do that. And also people with HIV are very highly susceptible to TB, and there also it's there. We already had a district which got the award for the highest number of HIV people with HIV testing. These are important things which we need to do both from the community side as well as from the clinical side. These two things has to have a very good connection. Unless we have that, we are going to have cases come here and there, or it is going to manifest in different manners. That's why infrastructure like this, culture and drug sensitivity laboratory, we need to test for almost all cases wherever they have a certain threshold to see whether, what treatment regimens we can have for people so that they might get into the treatment much earlier and it can be actually cured. That lab has taken some time, as Dr. Amika and Dr. Jennifer also pointed out. It was not an easy journey. It was a little windy, long journey. But I'm happy that we have the second BSL-2 laboratory. For those who have joined here, in entire Meghalaya, we used to have only one BSL-2 laboratory, which is where was in Nagrims before COVID. Today we have 3, in fact 4 we have. We have one in Tura, we have one in Pasteur Laboratory, we have one more now in C&DST now. So we have 4 BSL-2 laboratories. It's not this thing. It is in 4 years we have added so many laboratories, along with NAT testings, nucleic acid testings at the block level. We need to take it even further down to PHC level, because earlier the accurate identification, the success rate depends on so much. Our success rate of treatment is still a cause of concern, which we need to touch more than 90%. We are still at, I think, 82-83%. The topmost district has, I think, 87%, right? 87% was the topmost district. We need to reach 90% plus is treatment success. That's most important. The extra pulmonary TB which has come. Last time I remember doctor was telling most of this TB is not anymore pulmonary, which is not meaning happening in the lungs. It is happening in elsewhere in the body, and we need to identify them. So I also want to mention today that within the next 4-5 months, RP Chest will have its own CT scan machine also, so that you will be able to make that, scans and etc. here itself, so that we'll be able to identify patients with that symptoms, and where we can actually make this treatment regimen much more particular. And for this treatment to be successful, the very efficient classification of patients at multiple levels, whenever they join high risk, low risk, etc., which we already discussed once, that has to be put in place. And once that place only there, we can have very successful treatments and have efficacy in high efficacy treatments. Meghalaya has a bit of advantage when it comes to TB. because our rural population is much more dispersed, they are not staying together, the chances of the disease spreading from one person to another person is relatively lower. But however, since the households are smaller, the people in the households are actually susceptible to TB. And because of that, the screening is very, very important at the village level. So we have started the screening along with our ASHAs and other TB supervisors. We have the mid-level health providers also now starting to do the screening, which has actually improved the number of presumptive screening in some of the districts, which is very important. We need to involve the village health councils. Last year we have involved the traditional practitioners in terms of understanding the disease, giving them a certain kind of how do you refer, if you find some people with the disease, where do you refer them, how do you refer them. A nice pamphlet, simple pamphlet was already made, and that I really appreciate our team which has made the efforts. But this cannot be a only 1 year effort. We need to do this continuously every year with the traditional practitioners, because they will also have, a lot of them go there for small ailments and we don't have them in the thing. We need to refer them directly to the treatment so that this treatment can be done even more successfully.